My name's Carlene, and I'll be performing a cardiovascular and pulmonary exam. I'll first start out my exam by inspecting my patient's thoracic cage as well as her shoulders and muscles. Just looking for symmetry as well as masses, making sure there's no visual deformities. I'll next move on to palpation. I'll palpate first for symmetric expansion by placing my hands on her chest and have her taking a big deep breath for me. Great. Making sure that both lungs are symmetrical with expansion. Next, I'll check for tactile firmitis, placing my hands on her chest and having her say 99.
99.
Okay. Just looking for normal vibration, making sure they're equal on both sides. While I'm doing this, I'm also assessing for masses, any tenderness in her chest, which there are none. Next, I will listen to her lungs in the front. Just take a big deep breath for me when I put my stethoscope on your chest. Big deep breath. Perfect. And another. Good. Great. Checking at the second and fourth intercostal space on the right side of the sternum and the left side of the sternum as well. Coming underneath the breast, listening in the fifth, and then the mid-clavicularly on both sides. Okay, and I'll have my patient turn. We'll go ahead and listen to her back or her lung sound posteriorly. Taking a big deep breath for me. Great. And another. Okay. Good. Great. Making sure that I listen to her upper, mid, and lower lobes, making sure that they're clear, and they are clear anterior and posteriorly. Next, I will be performing the whispered pectoralogy. I will place my stethoscope on her back and have her whisper 1, 2, 3. Perfect. And for the next test, the bronchophony, I'll do the same exact thing. I'll just have her say 1, 2, 3, but speak it in a normal tone.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
One more.
1, 2, 3.
Perfect. And my last lung exam would be the echophony. So I'll just have her say E.
E.
Good.
E. 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 E.
One more.
E.
Perfect. Just making sure that nothing's abnormal and none of those exams were abnormal. Next, we'll move on to the heart, so you can turn around and face the camera for me. Listening to the aortic, the pulmonic, the tricuspid, and the mitral valve. Listen here. And then listen, second intercostal space, right sternal border as well as the left sternal border as well. And come down to the fourth. And then come underneath the breast and listen to the mitral. Okay. I'm also going to switch to the bell of my stethoscope and listen to her heart lungs as well. Her heart sounds. Oh, that doesn't work. That's okay. The breast. Perfect. Listening to the apical rhythm, I'll listen here at the mitral valve, which I did, just looking to make sure that there's no murmurs, making sure that the heartbeat is regular, which they were. I'll palpate the carotid arteries, never doing both at the same time. Perfect. Making sure that they're equal and strong, but like I said, never at the same time. As well as auscultating the carotid arteries, just making sure that there's no thrill or bruits. Goes. Also, just looking and making sure that her carotid arteries aren't distended as well. And that completes my cardiovascular and pulmonary exam.